For patients who present with a new diagnosis of myeloma with high-risk features, what are the unmet needs? I would say that the unmet needs are unlimited. The reason I think that is because the therapies that we use for patients who present with a new diagnosis of myeloma are typically the same across the board. A new diagnosed patient gets a proteasome inhibitor, usually with an immunomodulatory drug and steroids. Or if there is a renal insufficiency, the immunomodulatory drug is commonly used, switched to Cytoxan. Now, patients with high-risk disease, we know that they very commonly do respond to these different types of combinations of therapy. But unfortunately, we also know that they are more prone to relapse, and it can happen in 6 to 12 months. If the patient goes forward with a transplantation, usually that works out well, but again, the relapse could come 6 to 12 months after the transplantation. The patient chooses to go on combination therapy and go straight to maintenance because he or she is not a transplant candidate. Unfortunately, the relapse could come 6 to 12 months later. So I think we are at a juncture right now in the field treating myeloma where we see major advances in the outcomes for the patients in general. We see patients diagnosed with myeloma with standard risk having maybe 10 to up to 20 years of projected overall survival, which is fantastic. And during those 10 to 20 years ahead, there probably will be very many new drugs developed, so patients potentially could live with the disease as a chronic disease, and ideally maybe there could be some patients cured even. But at the same time, we have those patients that present with a very aggressive biology. They probably represent 10 to 15 or so % of patients. We still give them the same therapy because that's the best we have. And as I pointed out, unfortunately, they relapse. So the needs are enormous here. We really need to further understand the biology of these high-risk cases, probably carve out subtypes. I would think there is more than one type that falls into this category of high risk, and try to use insights from biology to develop new treatments. And also empirically to use new drugs to see if they can overcome the high-risk features of relapse and shortened survival.